Thank you, everybody, for joining us for what's new in NextGen Mobile. Mobile is one of my favorite solutions here at NextGen, and we're going to have a couple of mobile experts take you through our Metallica release overview and what's coming and what you can expect. And for those of you who use our mobile application, this should be some exciting news around enhancements. And for those of you who might be new to mobile, hopefully you'll get a good broad overview of the solution. So the way we're going to do this is for the next several minutes, we're going to be presenting some slides to you. In order to maintain the cadence, we're going to let the presenters fly through, but we do want to make sure we answer your questions. So you can use the chat feature or the Q&A feature to your right. You can just type in your question and we'll do our best to answer those before this session ends. Okay, so with that, I'm going to turn it over to Jeremy Dixon. Jeremy, take it away.
Thanks, Ted. I'm excited to be here with everyone today. Let me make sure I can get my slides going to take you through an awesome new release that we just put out on August 28th. So a couple weeks back, anyone who has mobile should have access to that now. I was looking at our numbers and we have about 70% of adoption of our current user base. So that's awesome to see that everyone has been picking this up. And just to give you kind of a high level overview of what we'll be talking about today. So I'll be driving some slides and giving some detail there, but then Kelsey's going to take it over in the second half of the presentation to do a live demonstration of the features that we're laying out here today. So what we'll be going over today is the ability to create a new task in mobile, document scanning using the camera in mobile, the ability to add a category to image only jobs, an update that we've shifted for anyone using charge entry on mobile, and that is using the SIM library now as the record system. An exciting update for OrthoSuite users on radiology orders and dynamic tags. And lastly, support for more document types in mobile around crystal reports and scanned images. So the first feature that we'll go over is around the new tasking. So around a year ago, we brought the ability to view and manage your task in mobile, but we didn't have enough bandwidth to get to the ability to create a net new task on mobile. So with this release, users are now able to create a net new task using 3 different options, either directly from the tasking module in mobile, through the PAQ on any of those items. And if you're in the patient chart looking at some of the documentation, you can generate a task directly from there too. And Kelsey will take you through what that workflow looks like in mobile. We've also added some support for task attachments. So we've included scanned items and labs. The labs are done only through the PAQ, and you do have to have the proper delegate set up in the EHR, but if you have everything configured, that will work just like you can do on the EHR today. And then 2 other things to note here are that tasks are searchable in the advanced search. So if you pull down from the top of the app in any area, you can search for patients. And if there's a task associated with that patient, it will show up now in the advanced search. And then like in the EHR, if you don't put anyone in the to line of the task, you can create a self task for yourself. And Kelsey will go through that as well too. And then one last thing to note here, just a technical area here to cover, is that the NextGen Enterprise API is required for this. So I'm assuming most everyone is on at least 5.90, which has the API. As long as you have that version, at least you're good to go. But if you're not, make sure you are looking at upgrading to the EHR version that does have the Enterprise API. Next, we'll move into scanning documents using the mobile camera. This one is super awesome. I'm excited for the demo of this. It's really slick. It's really awesome. But at a high level, this allows you to use the camera to scan in documents directly to document management. So 2 things you have to do. One, you have to have access in the EHR. So you need to have system admin preferences set up to be able to do the scanning. And then you also have to have the proper mobile default selected, and that's done through our cloud portal application. If anyone has any questions, we can definitely make sure you get the proper access to our documentation on that. But once you have everything set up, at the bottom of the patient detail screen, you'll see we have a new purple icon. So if you're used to this screen, there was just 4 icons. Now we have 5, and that new one is the purple one down at the bottom. You'll click that, it'll open the camera, and you can start scanning documents. And one of the cool things about this feature is it auto crops the documents, so you don't have to do the cropping on your own. It's very intuitive, it's very straightforward and easy. You can change it to do black and white scale, grayscale. You can keep it in color if you want to. There's all kinds of options once you get into the editing of that to get it exactly how you want. And then from there, you can file it into the category that you want back in document management. One thing to note is that this is not really meant to support hundreds of pages of documents. It's really focused on 10 pages at a time, so you can do 10 pages per batch. We think this will be a big use case, especially in the behavioral health field, the community health, the community based care out there, where you're on the go, you're out in the community. You may not want to drop those documents back off at the office or the next day. You can directly scan those in. Or if you have somebody who comes into your clinic with a couple of documents that you want to scan right away and not have to file away later, you can definitely use your iPhone, iPad, Android device to get that scanned in. Any questions so far, Ted? We can maybe take a couple as we're going through this just
There,
to knock
yeah,
some down.
yeah, there is one. The release notification that was pushed out today shows that the new version release is set to be released Saturday, September 15th. But today is September 15th. So is it Saturday the 18th? When is that
Oh,
being pushed out?
there is a release coming out this Saturday. That is for an iOS only update, and it is to include support for the new iOS 15 that Apple is pushing on September 20th. So the Metallica release was pushed out on the 28th. We're just updating our software to stay in line with Apple. It is an iOS only update and really only includes support for the iOS 15, which users will start to get next week.
Excellent. Thanks for that. And then one more, just a request. As you go through the different features, could you clarify which are included with the complimentary version?
Yep, and I do have notes for anything that is Mobile Plus. It does state it on there. So the previous 2 features are both in the mobile complimentary.
Excellent. Thank you.
Yep. Okay, so we'll move on. This is a mobile complementary feature. This is the ability to add a category to an image-only job. This has been requested quite a few times over the last couple years. So anytime you're in the mobile application, you can use the camera to take an image of the patient. Let's say it's a hand rash like I have here. And previously, there wasn't a way to add a specific category from document management. It went to a generic mobile images folder, and if you wanted to recategorize that, you would have to go in later into the EHR and then file it into the proper category. Well, we've heard that feedback, and we've put this new feature in where when you take an image, you'll now see a new field here where you can add the category. So as long as you have the category set up in EHR properly, it's going to mimic the access you have there and then show them. So when you click on that category button, it'll take you to the list of all the categories you have access to in alphabetical order. And some of these can be quite long, so we did include a search so you can easily find those and select those. Another thing you can do, if you have multiple, we've seen this in dermatology, there's a lot of image only jobs. You can set a default category for those job types. So that way you're not making your providers go and look for a specific category. You can just designate that on the job type. And then lastly, just because we've added the category feature does not mean you have to. So if a provider doesn't choose to add a category, it'll still send back into the EHR under the generic mobile images folder. Okay, moving on. This is a Mobile Plus feature, and this requires access to the Mobile Plus license. So anyone who is using charge entry on mobile today will know previously we used IMO to populate the library of codes that were able to be selected. With this release, we've made the switch to look directly at the customer's SIM library. So these are the codes that you have in your library. And what's great about this is that if you have any custom codes, let's say, for example, I'm sure a lot of you have adopted virtual visits and you may have similar codes, but there's a specific one for virtual visits. Well, IMO was not capturing that. So you couldn't necessarily do that charge specifically, or you'd have to edit it after the fact. Well, now we're pulling in your specific library so those can be seen when you look at those charges in mobile. So that's an awesome feature that we've added. So you'll now get those custom codes. And we've also added the fee to display on the charge as well too. So if you look at the miniature screenshot of mobile that we have here, we're now showing the fee. So if you have charges that have multiple fee structures, you can now show this. One thing to note on this is that we are only able to pull in the non-facility pricing from the SIM library. The facility level pricing is a bit complex, and we're waiting on some updates from the EHR to be able to do this. So just kind of wanted to throw that out there ahead of time. But this is a big win for clients who have been wanting this and have been using charge capture pretty heavily on mobile. And then last, just want to make sure that if you're looking to use this, that you are on the latest version of ExpressLink. That should be the case, but if you have any questions, feel free to reach out to us after this call and we can make sure that you are on the latest version if you're interested in using this. Okay, next, this is another Mobile Plus feature, and it also requires that you are on Ortho Suite. So this is a specific Ortho Suite feature that we've released, and this is around radiology orders and dynamic tags. And what that means essentially is if you have a radiology order that is on the encounter and you have these job types set up, so anytime there's an X-ray, an MRI, or a CT scan that has been marked as ordered and performed, it will apply to the specific job type that was configured to show up. So if there's not an X-ray on this encounter, the tags won't show up. But anytime there is, these will dynamically appear on that job, and it will allow the provider to interpret their findings and impressions. And when it delivers back into the EHR, it'll write the data from the dictations right on the screen here and mark that this has been interpreted. It'll insert that check mark there and do that. And that's a big win because this was one of the areas in orthopedic suite where the providers would have to log back into the EHR to complete this. Now they can kind of go full circle without even having to touch the EHR. So a big win for the Ortho Suite users who are dictating today. Ted, I'll pause for any questions to maybe catch up so we don't have so many at the end.
You're all clear right now.
Okay. And then last, before we get into the demo, a small update, but one that I think is important. We've added support for 2 new document types. Well, one in a specific area, but we do now allow Crystal reports to be viewed on mobile. So you can see these in the patient chart and the PAQ. One thing to note is that Crystal reports are not supported as a task attachment for tasking, and these cannot be signed on. So previously in the year in January, we released an ability to digitally sign certain documents. Crystal reports is not in that supported file type that you can sign on. And then one of the most highly requested feature enhancements was to include scanned items in the PAQ. The reason for this is because providers would see different PAQ numbers when they logged into EHR versus mobile. This was one of the main culprits of having that mismatch of number of the PAQ items. So you can now see that. We've added a new filter as well too. So if you look at the bottom part of the screen, there's a new filter where you can add those DM items into the PAQ or remove them, or any sort of options you want to do there. And then a smaller feature too within this kind of update is that in the documents and images section, we had this little icon, a little note icon, and it all said EHR. We didn't delineate what type of document it was. We now have made an update to show 3 different types of documents. So it'll pull across as like a DOC, an IMG, or a DM, just so that if there's a patient that has a lot of documents and the provider's looking for exactly what they want and the description isn't maybe clear, they can at least go and look and see what type of document it is, and it does delineate that. Okay, That's my slide set. I will now pass it over to Kelsey, and she's going to be taking us through a live demo. Ted, if you have any questions, I can take those as Kelsey gets set up for the live demo.
There was a question, I think you may have answered it, but let's just make sure. The question came through, is there any ability to auto-generate a task or POQ item for scanned document?
Yeah, well, that would be following the rules engine in NextGen. So if you have it set up to do it that way, are you talking about when you scan an item from the new scanning feature on mobile?
Let's see if Tyler can give us some clarity here. He says, yes, when scanning using the new scan feature.
I need to confirm, but if you have rules that are set up that when a certain image hits that category, it should honor that. But I can confirm.
Okay. So I'll write down a note that will follow up. And Tyler, I'm writing your name down. And then there's one other question I want to read off to you. Can you generate a PTA and send it to a staff when signing off an item from the PAQ?
What's a PTA?
Yep. Can we get clarity on what a PTA is? Provider test action. So can you generate a provider test action and send it to a staff when signing off?
Yeah. So currently mobile does not support sign off with actions like it does in the EHR. The API routes are not available for us to be able to do that. So it is something we've requested of the API team to develop. So we're waiting on them for those routes to be available.
All right, well, I've shared my screen, just hoping everyone can see that. Jeremy, Ted, are you able to see my screen?
We can.
Yep.
Great.
Looking
All
good.
right, and now if everyone on this call could just double tap on the middle of the screen, that's going to take you to kind of that full viewing mode, so you're not just in the WebEx mode, so you'll see exactly what I'm seeing. So here I'm in the mobile app. I'm going to take you through a lot of the features that Jeremy just went over with you. So I'm going to start off with our tasking feature. So the first place where you can go ahead and create a task is within this tasking module in the hub view. If you click on that, this is going to take you to your task page. So now you're going to notice in the upper right, this plus new. This is where you're going to create your task now. When I tap on that, it's going to take me to that familiar screen that you see in the workflow of the EHR, where you can go ahead and just type in your subject. You can add who you would like to send it to. Type in the body of your message. And now if I want to task this around a patient, just like the EHR does, then you just simply tap on that patient icon. You can go ahead and grab your patient from this list, search for the patient. I'm going to go ahead and grab this patient. And now you'll notice at the bottom, your attachment icon will show up. So that patient has to be pulled in order for that attach icon to show up, so it knows exactly what documents to pull from. So once I go ahead and tap on that attach, it's going to give me that option to select that document. And just like Jeremy just mentioned, we have redesigned so you can see what type of documents these are. So we have DOC for document and we have IMG for images, so you can quickly reference what document you would like to attach. I'm going to go ahead and just attach this disability form here. And now you'll notice in the bottom, I do have a red indicator notifying me that I do have an attachment where I can go ahead and just send that task off to Bryn Adams, my medical assistant. Another way you can create a task is from our PAQ. So this can be from any NextGen API approved item and documents, images, any scanned items, and then labs, just as Jeremy mentioned, but the caveat is you do have to have that delegate assigned in the EHR. So you can go ahead and tap on that document, and then you'll notice at the very bottom footer, it's redesigned. If this is a NextGen API approved document, you will notice this task in the bottom right where you can go ahead and create that task directly from the PAQ. When you do that from the PAQ, you'll notice that that patient and that document is automatically attached to that task. And then you'll simply just follow that same workflow. And I did want to give you an example of that note to self task Jeremy mentioned earlier. If a provider is running behind or he wants to send kind of a task to his to-do list, you can follow this same workflow. You don't even really have to fill anything out on here. You can just go ahead and type in what you want to remind yourself to do and go ahead and hit send. And you're going to get this notification saying you don't have any recipients. Do you want to go ahead and add this task to your to-do list? If I go ahead and select yes, it's going to add that to my to-do list for the provider to be reminded on the next day or later that day. So really just a reminder for that provider. The last place you can send a task is directly through the patient chart. So through documents and images on a patient chart, I can go ahead and tap on whatever I would like to task. And you'll notice this ellipsis in the top right up here. You're going to find the option to now send this as a task. Once I hit new task, it's going to send me to that exact same workflow, again, capturing that patient and that attached document automatically in that task feature. So there's the 3 places where you can now create a task. Now, just like Jeremy had mentioned, you can now search for a task in this advanced search. If I go ahead and search for my patient, and this works the same way as the medication task, where you're going to have to tap on this continue search on server. And that's going to search for any tasks associated to that patient. You can go ahead and tap on that task, and it's going to take you directly to that task that's attached to that patient. So really no new permissions around tasking, just really the ability to create them now. And then of course the expanded API approved items as task attachments. So I'll pause here before going on to scanning. Do we have any questions around this, Ted?
Looks like there was one, but Jeremy, it looks like you answered it.
Yep.
Perfect.
Yep.
And
Tasks
let's
cannot be saved to the patient chart like they can in the EHR.
Perfect.
That was
Okay,
it.
so moving on to our scanning document feature. You can either search the patient through the advanced search, or you can just simply tap on the patient in your schedule. If I go ahead and just tap on that patient in my schedule, you'll now notice that purple icon is showing up in the middle down at the bottom here. So once I tap on that document, that's going to pull up my camera. So I can go ahead and auto capture this document. And just like Jeremy had mentioned, if you have the auto capture on, that's going to auto capture that exact document that you would like to take a picture of. But of course, you do have the availability to go ahead and resize to your preference. Say you only want half of the document, or you do want the full document. You can go ahead and do that using your fingers, using that 4 corners. I can retake or keep the scan, and that's going to drop that into the lower left. Now, as Jeremy mentioned, I can take pictures of up to 10 images. And if I wanted to go back and review, I can simply click on that document and I have the option to crop, use grayscale, rotate, or delete. So kind of those same options as you would as taking a picture through your iPhone. So we'll go ahead and select done. And we'll go ahead and select save. Once you select save, it's going to take you to that screen where you can select that document type. Now, all of these document types are the same ones that you have built in the EHR. So you'll have those same options to choose from. So if I go ahead and select document type, this was an operative report. I can go ahead and quickly do that, fill out my required fields, and then I can go ahead and send to chart. Now it's going to give me the option to either save the scan or delete the scan. By saving the scan, that's going to send it directly to the patient record. But I do want to just pause and take a moment. If that provider was in the middle of a scan and he gets interrupted, he needs to come back to it, he can always come back out. And you'll notice I do have that indicator in the bottom here notifying me I have a scanned document waiting to send to the patient record. So that's always going to save just in case you need to come back in and out of the patient chart. And the indicator is going to notify you of how many documents you have resting in that patient's chart. So I'll come back in and I'll go ahead and send that to the patient's chart. And then you'll notice the uploading and the percentage of that file uploading, and it'll post as a batch. So now if I come into documents and images, you'll notice under our hospital ASC documentation, we now have this op report that was just scanned in. So the next feature was the attaching a category to.
Hey, Kelsey.
Yeah, go ahead.
There's a couple of questions, so I wanted to stop before we move on. So
no problem.
one question question, is there any significant differences between how things will look on an Android phone?
No, the functionality exists there. There's a bit of difference in the UI, but that's just because the way, Google and Apple have decided to do design things. Like for example, the way you navigate the phone is a little bit different. Some of the menu icons are a bit different, but for the most part, we try to keep everything exactly the same, other than like small UI differences. So functionality is the exact same.
Thanks, Jeremy. And then one other question, kind of going back to our tasking conversation. Can you see tasks assigned to someone else?
Yeah, no. In the EHR, you're able to flip between users and you can see different lists. That's just not a concept that we have on mobile today. So unfortunately, unless you're on the task with multiple people, you won't be able to see it.
Okay. Thanks, Jeremy. Kelsey, you're back on.
All right. So moving on to the image only jobs, being able to assign that category, just quickly go through a quick demo for that. So if I tap on my patient, again, I can do it from the schedule or from that advanced search. If I tap on my camera here, I can take my photo. I can go ahead and do my annotations. I'm going to go ahead and use that photo. And now I can go ahead and attach a category, my description, and send that right to the patient's chart. So now that's going to file under that categories view under the derm body exam in that patient's chart. So pretty simple, straightforward demonstration. Not much to it there, but really great to be able to categorize that now so you can quickly find those images in that specific category when you're searching for a specific image now in the patient chart. Any questions on that before I move on, Ted?
Yeah, there's a couple questions. So, and it looks like Jeremy's answered. Can you use the mic instead of typing when you are entering text? And
Yes,
yes,
so
can you?
you can use the mic at any point in time. So when you pull up the keyboard, depending upon what kind of operating system you have, you can always use the keyboard. We don't restrict that. One of the things that we do have on the Mobile Plus side is when you're entering in clinical data, we allow you to access a medical grade speech technology that is, more in tune with clinical dictation terminologies. What Kelsey just showed is just using the iOS keyboard microphone, so that would be using Apple. So yeah, you can do it, but when you get into some of the more dictation heavy workflows, we definitely recommend that you use the included um, medical grade dictation service that we have.
Yeah, and I think you answered that follow-up question, which is if you use the mic, does it understand medical terms? And that's what you're getting to, correct, Jeremy?
Right, but like when Kelsey showed like the description of the hand rash, it wouldn't be using that medical grade speech technology. We don't have it baked in there. I think most people just use like a quick description, so it's not a lot of text. But yes, we can. We would love to get you on a demo to show you some of the speech to text dictation that we do have because it is really awesome and fantastic. I see the other one is the PAQ free version or paid version. PAQ is in the free version, complimentary.
All right, so now I'm going to take you to the charges. Again, this is a pretty quick demonstration. Just want to show you, what that looks like on the mobile. So this is when charges are entered. They're now validated against the SIM library, and they pull that non-facility pricing. So if I'm in a patient's chart and I want to go ahead and add a new charge, let's say 99213, it's going to pull up all those different levels of codes that you have built in the SIM library. So here you notice 2 different office, and then you have those telehealth levels specific to payers. And then to the right of that, you see that it's pulling the non-facility pricing. So pretty straightforward. Again, just wanted to quickly show you that on the mobile application. Any questions with that?
That is a part of that would be a part of the Mobile Plus tier, the ability to do charge and diagnosis entry.
Very good.
Perfect. So then the last thing I'm going to demonstrate is that ortho-specific dynamic tags for the radiology findings and impression. Now this is specific to clients that are on Ortho Suite. We now have the ability to have the provider dictate directly into the impressions and findings templates on dynamic tags. Again, these dynamic tags are only going to show up if there is an order on the patient's chart and that order is performed. So now you see here, I do have those dynamic tags listed down here at the bottom. Here I have radiology findings and impression. I see that a left knee PA45 was taken today. So now the provider can go ahead and dictate into these tags, which I'll quickly demonstrate to you right now. And then I'm going to take you over to the EHR to show you where that lands. Unremarkable left knee with no signs of fractures, dislocations, or degenerative changes, period. Normal left knee films, period. So once I go ahead and send that over to the patient's chart, of course, that might be along with some other dictation from the provider from that dictation for today. I'm going to go ahead and switch over to the EHR. And this takes a couple seconds to flow into the patient's chart. So once we scroll down here, we go ahead and open this up. Now you see this is flowed directly into the patient's chart. Here's my findings, my impression, and then you'll notice that the interpretive checkbox is automatically checked once that dictation lands into the X-ray order template. So really great features for providers to be able to use the dynamic tags to send that information over as discrete data into these specific templates, into the correct templates, and then that interpreted box automatically being checked once that dictation lands in the template. Any questions on the orthodynamic tags?
Not seeing anything. Looks like we had one question, but Jeremy fielded it, so I think we're good.
Perfect. Well, that's all I have for my demonstrations today with the features that Jeremy went over.
Yeah, so I mean, Ted, we can open it up for any questions that people have at this point, or if there's, none, we can give a minute or so to see if there's any more.
Yeah.
But that is basically it for the Metallica release.
Okay. Is there any plan to make existing values viewable in NextGen Mobile? We have many groups wary of using NextGen Mobile dictation because they're concerned they will overwrite data.
Is there a plan to make existing value? Oh, I see. Pulling forward data. Yes. We do, but there's a lot of complexity around stored procedures. We have to go back to the drawing board to figure out how do we pull that into mobile based on the data architecture. So I get what you're saying. It's a fairly complex problem, but it is something we do plan to address sooner rather than later.
All right. Any other questions? Got some good ones so far.
I actually see a question here. Are there future plans to open the orders up to other specialties?
Yeah, for sure. It's just depending upon kind of the demand. What if you would give me an example, I would love that, because we're just trying to get as many of these features and enhancements that we can on the mobile side out. So would love to get specifics. If you can put it in the chat, I would love to kind of take that back to my team.
And a couple other questions. We recently found that when a chart note is signed off from NG Mobile PAQ, that the sign-off text appended to the document does not include provider credentials. Will that be fixed?
Yes, it's a KI we have tracking. I don't have a firm ET on the date, but we do have it as a KI.
Okay, and another one that was sent, are macros going to be pulling on these documents?
Repeat that, sorry. Well, macro, what?
Are macros going to be pulling on these documents?
Yeah, so you're talking about macros for dictation, I'm assuming?
I would assume, yes.
Yeah, so for macros, you can definitely support those. You can do them via speech to text, so streaming text like Kelsey showed today, where the text appears right away. Or if you use like transcription or transcribe services, we would definitely get with you before you went live on that solution and get all of your macros entered. So your transcriptionist or scribe could use those preferences. But we do the same thing on speech to text as well.
So they responded on that specialties for the imaging orders, OBGYN, urology, general surgery.
Okay. Yeah, for sure. We'll definitely take that into consideration and figure out how we do that. But these are the orders specifically, right, within those modules?
I would assume so, yes.
Yeah.
Yes.
Okay.
Yep. And then another question that came in, can we select what images can go to the provider's PAQ, or all pictures taken are going there?
It depends on the job type. So when we configure jobs in mobile, you can choose to task them or send them to the PAQ, and that's all configuration based. So that would be done in implementations or with your project manager.
Okay, and then looks like there's another one. Can changes be made within the demographics, such as address, allergies, phone number?
No, those are not editable on mobile today. Those are reflected, basically a real-time call to the EHR to pull that information, but not editable today. I think some folks are weary to give providers that ability to edit those on the fly.
And I've got a couple here, Jeremy. How does the mobile platform integrate with the database? And then further clarification on the question, meaning for non-cloud hosted NextGen.
Yeah, sure. So to not go too into the technical weeds, there is an API that we call ExpressLink, and that is installed on your server base, and it acts as a connector from your NextGen instance down to the mobile device. And we walk you through this installation. It goes up on a separate server, and when you go through implementation, we walk you through all that. It's set up, and that is the connector that ties your database to the mobile phone, because the mobile phone is pulling information real time. So all of your clinical data, your schedule data is pulling from that ExpressLink call. And then some of our newer technology, charge capture, medications, tasking, that's using the NextGen Enterprise API to pull that information. And we have a ton of documentation around that. If you really want to get into the weeds of like how the data moves, it's a fairly complex spreadsheet and workflow diagram that we have for that.
Very good. Thanks, Jeremy. Another question. Are there any plans to implement the telephone template to the mobile version to be able to save those tasks?
Yeah, we're looking into this. So today you can do the telephone note, which with what we call tap templates, and it's very basic discrete data entry. But we haven't built in the tasking feature. So we're working on that. We're working through some of the technical complexities now, but it's a big ask from quite a few of our providers. But yes, the answer is yes. I don't have an ETA, but hopefully here soon.
Very good. And I believe, Kelsey, I think you read the one about changes in demographics, right?
Yes. Yep.
Okay. We're going to say last call for questions. In the mobile app, it shows allergies, but when you open the patient, it shows NKDA. Can this be edited to show 0?
Yeah. This is another KI that we have, the no known allergies, and it does show 1. We're working on this. That was a miss on our side. So apologies. I bet providers click on that and then realize it's not an actual allergy. It's just saying they don't have any allergies.
Can you talk about ERX of EPCS, i.e., heard of obstacles with the government and appreciate the dual factor conundrum, but will this be available ever?
Yes, it will. Don't hold me to this, but we are starting development. It's fairly complex, but we have gotten approval from our regulatory team here at NextGen to move forward on this. We anticipate the feature to come out sometime late summer of next year.
Got it.
And it will be done completely on the phone. So it'll use the two-factor authentication that you're using today with either Symantec or IdenTrust. And you'll just have to have that mobile application downloaded on your phone, as well as the mobile application, and you will be able to do EPCS. So we're super excited to move forward with that. It's been highly requested for quite some time now. Like you said, there was some government regulations that were impacting doing the two-factor on mobile. Those have now been lifted in the last year or so.
It's exciting. Another question, Jeremy, is there a lag between data entered via mobile to the actual EHR?
No, it's pretty real time. When you're talking about, images, dictations, task, as long as your network performance is good on your phone, it's usually very quick. Like, and it could depend too. Let me throw out a scenario. If you're dictating for an hour, it could take a couple minutes for all of the text that you've dictated on your phone to make it back into the EHR. But for the most part, I can do a dictation on mobile, a fairly lengthy one, say 4 or 5 minutes of audio, send it over. By the time I log into my NextGen instance on the desktop, it's there within, 15, 30 seconds most times. Kelsey, would you say that's pretty accurate when you're doing demos yourself?
Yeah, I'd say that's pretty accurate. It's almost instantaneously. I mean, it flows right into the chart pretty quick, like as you just saw with just that X-ray demonstration. I
Right.
mean, it was there, within 10 seconds. So
Right, right. Yeah, and typically we've only had challenges when, like I said, a doctor or provider is doing like an hour-long dictation. That can take a couple minutes for it to process back over to the EHR.
Let's take one more look here.
I see one here on my end that says, any plans to allow users to use their Active Directory password to sync into NextGen Mobile?
Yeah, we get this quite a bit. I don't have any plans right now. It's requested pretty frequently, so it is something I'm looking into. I need to work with our NextGen teams to understand how we're doing that on NextGen today, to see how we then translate that down into mobile. So, not the first time I've heard this. It's pretty frequently asked about. So, hang tight, and maybe we'll have an update next release on where we're at with that.
And a follow-up to that, Jeremy, what about using their current EMR user and password to log into mobile?
So yeah, the way we do it today is you have your NextGen mobile user and password. When you log in with that, we connect you real time with your EHR credentials. Um, there's a lot of complexity around doing the actual EHR login that I won't get into in this call. But yeah, we're definitely exploring better ways to do the login than just a separate mobile login.
Oh, another one on passwords. Let's see. But if the EMR changes password, does that?
No, because we're storing a token on that,
Okay.
so we'll keep up with that. The one thing that does break it today is if you're using Active Directory for the NextGen login and that changes, that will break the system, and we have issues with that. But for changing the NextGen password, no, we have a token system that stores that and is just checking to make sure that it's validated constantly. We don't actually store the NextGen password. We just verifying that that user does have an active account and the password's good.
Okay. Other questions?
I'm just looking back at the very beginning from when we started, and it looks like there was just one that they're just interested to know where the documentation is to review the cloud portal setup.
That would be in Success Community.
And oh, someone just asked if this was recorded so that they can watch it again, and that is yes, it is recorded.
That'll be posted on Success Community and or sent to you as a follow-up. Jeremy, I think that's it.
Okay. Well, thanks everyone for the great idea and the great conversation.
Absolutely. Everyone, thank you for your time today. We really appreciate your partnership. We appreciate your interest in our mobile application, and we wish you great success with it and with your practice. We hope you're staying safe, and best of luck to you, and hope you have a great rest of the week. Kelsey and Jeremy, thanks so much.
Thanks,
Take care,
everyone.
everyone.